This is mostly evenings and on the weekends. I grow pole beans, bush beans, tomatoes. Volunteering, it's maybe 1 day, 2 days of coming and helping. But this is more of growing a community. And I always say that people just don't know how cool East New York could be.
This population really wants to be involved. They want to be engaged. They want to use their time and talents to the benefit of others.
We can't ignore the demographic shift that's happening in the United States, and that we're going to have over 70 million older adults in our communities over the next couple of decades.
That's what this longevity revolution really provides. It provides us 20 to 30 years of healthy living. And with that, what are we going to do with it?
This is a community that prides itself on our ability to care for our neighbors. When I was elected mayor, I joined the chair of the County Board of Commissioners in calling for a decade to end homelessness.
Habitat brings people together to create affordable housing opportunities for families, and what the Encore grant has done for us is allowed us to recruit older adults, experienced adults, to help us with that work.
This was Habitat's first project where they've just identified a veteran's family and focused on that community to build a house for. Many people like myself are semi-retired or retired, and many of them have been handymen or they've had to do repairs on their own houses, and they develop skills that they can use in the habitat construction.
It's creating lifelong sustainable housing opportunities for low-income families, and that's what's changing. That's what's breaking the cycle of poverty.
Colorado, for years and years, health and fitness and wellness has been a priority. I think also we've had some really good leadership around healthcare issues. Foundation leadership, nonprofit leadership, political leadership.
With the Boomers Leading Change in Health project, the whole idea was that through using healthcare navigators and healthcare advisors that we could lead to a more efficient and more cost-effective healthcare system.
When I was working in this field, I became very passionate about trying to make the changes that need to be made. And then when I quit working, when I retired, that passion didn't go away. I still cared very much about the issue and want to stay involved in it.
We have about 125 volunteers that are either healthcare navigators, community health workers, or advocates.
We had a group of nurses, for example, that had been volunteering with us, and they were all retired. It was 6 or 7 of them. Their network was of tremendous value to us, and their expertise on the ground was more than we could have paid for.
Older adults are, to a great extent, the consumers in the healthcare system. And so we've got, I think, a pretty big stake in this issue, but also we have experience with it. And I think those two things can make our contributions really valuable.
We used to have 2 fruit stands in this neighborhood, and they're both gone. You would get off the train and there was a fruit stand, but now there isn't one. There is a fast food place.
High blood pressure, low blood pressure, obesity, and all these things can be dealt with and conquered through what we eat.
Fresh food production is not the first association people have with East New York or Brooklyn, for sure. But people are really stepping in.
Numerous community gardens were started or strengthened. A farm stand was launched. A fresh, healthy food buyers club was established.
Seniors that are working full-time jobs still, waking up at 4 o'clock in the morning, coming to the markets, doing cooking demonstrations, educating other people.
The activity was unbelievable. And I think that's directly due to the fact that we engage people who had a passion for this issue, who had lived in these communities for 30 or 40 years.
When you volunteer, you're told what to do. Now, I'm the coordinator of this garden, and I come in and I know what needs to be done, and I know what I have to do, and I do it.
My mother was the kind of lady that she could drop a seed in the ground and point at it, and it would just grow up. So this is an opportunity to not only pay homage to my mother, but to do something for my community.
I think East New York Farms is the bomb. Is that the expression?
There are now communities out there that have proven that older adults can be an asset to a community, that they can make social change.
What would it look like for communities if part of what was expected and part of what society supported was for older adults to step forward and address important issues in their community?
There's a small treasure trove of resources in place, accessible for people, community foundations, funders, community-based organizations, municipalities. There's a learning community now. There's a website. This is only the tip of the iceberg. And we proved that older adults, if you give them the opportunity, yes, they can make change.